to reflect on what has been discussed and strategize on how to put those concepts and ideas into action. Now that we are on the road to the next big opportunity coming up, the 4th UN high-level meeting on NCDs in 2025, we all need to join hands and accelerate our action. In 2024, the world is off track to meet the global NCD targets that we all agreed upon. These are set to expire in 2025, and only 6 countries appear to reach the targets of reducing NCD mortality, to reduce premature death by 1/3 by 2030. And we know that many promises that were made at the last UNHLM in 2018 will go unmet. As a consequence, the global NCD burden which we face today is unacceptable, inequitable, and increasing. It remains nothing short of a public health and sustainable development emergency. With billions of people around the world living in environments that promote illness rather than health, and billions more lacking access to life-saving treatment and care, the action needed is more urgent. This is not to say that no progress has been made. Over the last decade, there is no doubt that some governments have taken bold action to prevent, treat, and finance NCDs. And these beacons of hope in leadership must also feature in the next UNHLM narrative. They need to be celebrated, be promoted, and learned from. As they feature in the NCD Alliance Global Week for Action campaign, we launched this campaign just last week. It focuses on the theme of leadership for the next 2 years. So we would want to celebrate these beacons of hope in our campaigns. But why do we need to start working 16 months before the 4th UN high-level meeting? It is because the world is not where it should be in the global NCDs. National action, international cooperation has simply not matched the scale of the challenge. We are failing the billions of people at risk or living with NCDs worldwide. So when NCDs return to the UN next year, for the first time in 7 years, it is a golden opportunity to assess progress, promote these beacons of hope and success stories, renew political commitments at the highest political level, accelerate action to get us back on track, and let's reset the agenda. And when I say reset the agenda, I mean repositioning NCDs, because we are seeing rapidly changing, complex global landscape and framing action on NCDs as a necessity, an imperative, a priority to respond to this polycrisis we face today. Governments may be too late to meet the global NCD targets originally set for 2025, but we still have a chance for 2030. The time is now to show true leadership on NCDs. With that, it is my pleasure to hand over the floor to our moderator, Suili Ghosh.
Thank you. Thank you. Thank you very much indeed, Monica. And as she said so succinctly, 2025 is going to be a pivotal year for accelerating action against non-communicable diseases, and action is critical. So today we're going to gauge where we are as a global community in the goal to prevent and manage NCDs. We have an excellent panel of speakers for you, consisting of leaders from government, health and civil society. They're going to share some of their achievements, but also highlight where more action is needed, more support is needed, and we'll explore some of the key themes and priorities for the UN high-level meeting next year. Our speakers will be including the Minister of Health for Rwanda, Dr. Sabin Nsanzimana. We're delighted that he's going to join us. He's joining us a little later on. He sends his apologies for not being able to be here right from the start. But with us now, I'm delighted to introduce, on my immediate left, the Honourable Lois Pace, Assistant Secretary for Global Affairs at the US Department of Health and Human Services. Sir Ashley Bloomfield, Professor in Population Health at the University of Auckland and former Director General of the Ministry of Health New Zealand. Dr. Bruce Aylward, Assistant Director General of UHC and Life Course at the WHO. Dr. Karen Seeley, Executive Director of the Trinidad and Tobago NCD Alliance. Katie Dane, the CEO of NCD Alliance, and Trevor Shilton, Board Member and Chair of the Advocacy Committee at the World Heart Federation. Please give them a warm welcome. So I'm going to start with you, Bruce, actually, because as a face of the WHO, we'd like to know what is the WHO vision for how NCDs are tackled and how they fit into global strategies like universal health coverage.
Thank you very much, Shuli. Can I be heard way down the back? Yeah, great. Not that I have anything important to say, but thank you. I do have important things to say, but the most important thing is just a thanks first to the World Heart Foundation and to the NCD Alliance for bringing us together today. And a huge thank you to everybody who's shown up in what is a full room. It's a beautiful, sunny, nice day out there, and I think the fact that everybody has come together here today to reflect on this issue, look at how we create some more momentum going into the high-level meeting is so frankly encouraging when you're sitting here as speaking for WHO. So thank you all for being here. When we talk about the context, if I could say a word about that first, Shuli, the reason you're all in the room, we're all in the room together, is we're badly off track. And we hear the statistics again and again, right? Huge numbers. 4.5 billion people don't have access to basic services. 2 billion people are suffering financial hardship just when they try to access life-saving services. This is a catastrophe, and what's really, really paying a price in terms of health and well-being is, of course, in the area of non-communicable diseases. And we've got 41 million people, I think our most recent estimate, people dying. 75–80% of deaths due to non-communicable diseases. This is a no-brainer. The question you put to me, Shuli, about where this fits in the WHO agenda going forward, this is the heart and the entire agenda as we go forward with numbers like that. A cost, the human toll is one thing, I mean, horrific, and then we have a horrific economic toll as well. We simply cannot afford on an economic or a moral basis not to really tackle this. And we need to get that momentum now moving in the run-up to the high-level meeting. So fabulous that we have this event and a chance with such a fabulous panel to talk about it. On the WHO side, I think as many of you are aware, among that huge stack of documents that the Assembly will discuss next week is a super important one, not because I held the pen, but a really important one called the Global Strategy for Health and Well-Being over the next 4 years, what we call the General Program of Work for WHO. What that lays out is our vision for the big priorities for global health and what we as an organization need to do to support that. Now, this global strategy was not put together by WHO. I mean, it was put together, was penned, but it was in consultation with a huge number of governments, obviously, but also civil society actors, NGOs, youth groups, private sector associations, our UN partners, and was all about aligning on what's important, where do we need to move the needle. And we aligned on 6 big strategic objectives, all the way from climate change and health through determinants, systems, into emergencies. And anchoring all of that in every single one of those, you find the NCD agenda, whether it's the risks posed by climate change and how we tackle those, determinants, how we tackle the health promotion agenda and the determinants of ill health that drive so much of the NCD burden. And then we get into the systems part, which is all about getting the workforce there, getting a primary health care approach in place that can move the agenda on non-communicable diseases. And then we get into the basic service packages. One of the things you'll see in the fourth strategic objective, for those who actually read this, is the emphasis on financial protection. We can't solve the NCD problem without financial protection. The poorest in societies need to be able to access medicines and services they need for free, period. And that is the responsibility of governments. And we put it right there on the table. We can't move the NCD agenda without doing that as well. So right across those objectives and into the emergencies area, where NCDs are often in the past completely forgotten as we worried about infectious diseases, et cetera. That's a foregone or a past gone, a bygone era, because now the world is oriented, and in part due to the fabulous work of the NCD Alliance and all the partners in it who have done such a job in educating the world. So we're going to roll out a new strategy next week. It's not WHO's strategy. It's a strategy, a vision for the world. What's important, what we need to focus on. The part I didn't mention is what WHO needs to do, because we do enunciate really clearly. We'll play our part, the convening, the partnering part, the leadership part. And I use leadership small l, right, because it's a responsibility that we have. Then we've got our normative work that we do, reflected in great things like the NCD best buys, right? Then we've got our differentiated country support and how we will help the different countries with their different needs to advance on the entire agenda, but especially, and at the heart of it, the NCD agenda. We cannot achieve, that big goal, health and well-being for everyone, everywhere, without really tackling the NCD agenda. We've got that. The voice of WHO, the power of WHO and its member states and partners, and the technical abilities that it has and that it can convene will all be brought to this agenda as we go forward. So now, last point I'd like to make. Do I have time for one last point, Julie?
We are.
I'm watching the clock here.
Yeah, that entire 50 minutes is not for you.
I think the other ones ran long. Okay, rather than debate you, my last point. As we run up to the high-level meeting, folks, I think we're in such a different position than we were in 7 years ago. Now we have got great solutions. We've got great best buys. We've got a great recognition, great alliances who are behind this agenda as well. And we also have proof. We always talk about the problems, right? And that's really a challenge to move political will. But there are so many countries, I think, that have actually moved the needle on this NCD agenda. Got to fix the financing, got to have the political support, and that's what we're looking for at the high-level meeting. So thank you for everything everyone is doing to move that agenda, and
Great overview.
Join us.
Thank you very much indeed, Bruce. Let's drill down a little bit into specifics then. Karen, if I can come to you, someone who lives with NCDs. You founded the Trinidad and Tobago NCD Alliance. You coordinated the CARICOM NCD campaign. What are the specific challenges in tackling NCDs in the Caribbean region?
Hi, good afternoon, everybody. Again, thank you for being here. I have several NCDs, and I have come to recognize that I am fortunate because I have access to healthcare. But I have also come to recognize from my experience, not only of my own, but my parents' experience, because both of them were social workers, that in fact, if the government does not do something to help persons live with a healthy strategy, then we are going to be in trouble, because we cannot treat ourselves out of NCDs. We have to, in fact, have the gamut of from promotion to treatment, care, and support as we go forward. My NCDs, the two that I will refer to are, in fact, obesity and its equally, and one of the coronary diseases which I have. I did have cancer of the breast and coronary disease. I want to talk about obesity because it is now recognized, hopefully, how central it is, not only as a risk factor, but as a disease in and of itself. My experience was when I had the first diagnosis, before that, actually, when in a discussion with one of my colleagues from an organization with which I worked, I was in fact very offhandedly told that the person did not see why losing weight was a problem. It's a matter of having willpower and being able to do the math. The calories in, calories out, you just have to calculate it. And I was really surprised of this coming from a senior person that I worked with. Then when I did get cancer, my first diagnosis, I realized immediately after that, that when I started the treatment, I wasn't hearing about obesity. I was hearing about smoking. I was hearing about perhaps physical activity, but not obesity as a factor. Obesity was, I was counseled about obesity, but for cardiovascular disease and diabetes. The association with cancer, if it was there, I missed it totally. But it really was not there. And that's one of the concerns that I have as we go forward. And also, I learned from my own experience that this has to be everybody's business, NCDs, not only from, as we say this, the government and the intergovernmental sector and the NGOs, but the whole family. I did not pick up on my shortness of breath until my husband pointed out to me that I had made that statement 4 times in about a week. And that's when it all started. And in fact, I ended up with a stent. So my experience, I always keep front and center of not only myself, but of persons who I see with NCDs, especially those who are stigmatized, whether it is diabetes or obesity, that we have to also work on that as well. Why is the Alliance in Trinidad and Tobago? Well, it has to do with the success of the NCD Alliance. I happen to have been the PAHO advisor in the UN office, WHO UN office, from 2009 to 2014, and therefore worked with the CARICOM permanent representatives to get NCDs first on the development agenda at the UN, and then to have that high-level meeting. It was in that process that I, in fact, saw the role put into practice of civil society. And I recognize a couple of things that I want to point out. One was the ability to talk to, in fact, the said permanent representatives in simple language, both to talk to them and to produce documents about the policy analysis in simple language. And I realized that the representatives were using these documents. And when I asked them, this is one of the reasons many of them said. So I said, that's something, obviously, we are not doing, and by we then was the Pan American Health Organization and the World Health Organization, I have to mention there. The other thing is to be able to recognize the need for research and do this quickly, and do this just to the point that the representatives will need to be able to make the policy decisions that we wish them to make. And so that was the third thing. And then, second thing, sorry. And then just basically, how important it is to build credibility as a partner as we go forward as an alliance in Trinidad and Tobago. So those are what drove me to it. And let me just tell you about 3 achievements. We, in fact, advocated over years for the establishment of an NCD unit. I have to say something here. I happen to have been the consultant who drafted the terms of reference since 2016, but it took a lot for the government to want to do this. They wanted to work on NCDs, don't get me wrong, but the value of the NCD unit took a little while, and we continuously advocated for this, and it's now established. During the COVID time, we, in fact, were able to help the ministry to distribute vaccines through one of our we have 13 organizations in the Alliance, and because we were working together, one organization, in fact, was making sure that persons living with NCDs in those 13 organizations had received the vaccines. So we were then able to turn our attention to a project with Pan American Health Organization and the Ministry of Health and a group of private practitioners who had made some strides with telehealth to be able to make access to general practitioners.
Karen, thank you very much indeed for sharing that with us. Lois, if I can come to you, I think Karen's laid out some of the challenges that we see with how NCDs are approached, particularly in low and middle income countries. What strategies has the US supported? Have you seen progress?
Well, First off, this feels like a pretty great reunion for me because I'm here on stage with people I remember meeting in advance of the first high-level meeting in 2011. I don't want to date Katie too much, but I remember when she was starting at Baby NCD Alliance 15 or so years ago. Of course, Dr. Seeley, we are so grateful to you for your leadership, and obviously, Sir Ashley, he and I were reminiscing that we met in this space.
So this is basically a reunion.
It is really, and with all of you. So, you know, I start with that personal story just because it's followed me into this role that I have now, and I'm here even with colleagues who have been fighting the good fight in the U.S. government to help even our colleagues there understand that this has been an issue for a long time, obviously, but remains an issue that we need to tackle. And, you know, if we just step back and think about what we've all lived through the past few years, I think one fear that we've had internally, and even frankly that my colleagues have shared, is, oh no, now no one will pay attention to NCDs. We were just so close, right, to people really starting to understand it. But what I think has happened, and again, credit to the Alliance and its partners for doing this, is people have been able to understand the linkages that Bruce was describing, right, between, say, global health security and pandemics and its effect, outsized effect on people living with non-communicable diseases, let alone people's risks to NCDs. We also, within U.S. government, are thinking about other or additional connections, right? He made some really important points about the social determinants of health, and you all might have heard from me or from others the central role that equity is increasingly playing for us in the global health or public health space. As we focus more on social determinants and health equity broadly, we absolutely have to bring NCDs into that conversation in a natural way, not only in a way that connects to health services and access to health, but even to public health and risk. So that's one other way that we are really trying to be concrete about this connection. A couple of other ways, again, building on the COVID-19 pandemic, and welcome, Mr. Minister, Honorable Minister, it's good to have you here.
Oh, fantastic. Yes, please take a seat. Please welcome the Rwandan Minister of Health, everyone. Thank you so much for joining the conversation. Please carry on, Lois.
No problem. So, you know, a couple of other recent events have facilitated this connection as well. We had the COP conference, the climate conference this past year, which finally had a health day. And I think that gave us the ability to talk not only about global health security or infectious diseases, but also the impact of climate and the environment, again, on NCDs, spurred by a lot of the work that's happened by people in this room. A final example I'll offer is actually it's twofold. We have an upcoming high-level meeting, obviously, on AMRs. Not everybody connects antimicrobial resistance to NCDs, but I think many of us, and people like me who worked in cancer for years, and that was my entree into this space, understand that critical connection. So increasingly more people in that community of AMRs are starting to talk more to people who are working in cancer. So I say all this because I think while we had this fear that NCDs would once again just be lost or just sort of sent to the bottom of the pile, we are seeing it resurface or be kept afloat by these other issues. And I give credit to a lot of people here by just continuing to be creative about what it is we could do to connect those dots. And it allows people like me now in the role that I play here within government to do the same.
Lois, thank you very much indeed. Dr. Sanzimana, welcome to our discussion. So we're talking about the challenges and the progress that's been made in the battle against NCDs. I know that Rwanda has a national strategy on NCDs. Perhaps you could share some of the highlights of your government strategy.
Great, thank you so much, and good afternoon. It was a great time to join Geneva. It's a busy week, so we're moving from a session to another. So, yes, you're right. We have NCD strategy. It's not the first, actually. We've had the same strategy before. And it builds on the evidence we have, the data that actually now more people are dying from NCDs than infectious diseases, which is something we saw as a shift in the years 2014, 2015. That's the first time we started to see more death related to NCDs superseding the infectious disease related mortality. So our strategy has, of course, several pillars. NCDs are better managed when they are prevented. It starts with lifestyle. We're working around some, actually I would call it challenges, in a way that some of the lifestyles in our communities are rooted into the practices of our communities in the past that, for example, if I use the food and consumption, let me pick the example of milk or alcohol. These are the things that if you trace back in our communities, you will think that it's strongly rooted in the culture and the society. And when you start to tell people that too much milk is not good for your health, while our mothers and grandmothers have been always saying milk is everything, and you can't stop. There's no maximum amount of milk you have to consume. So this is something that we are dealing with difficulties. I remember sometimes going into on television, on social media, telling people that you should not drink a lot of milk, salt, sugar, and alcohol. So I was like, people saying, "What are you talking about?" These are the things that we never had before. Is we were used to tell people malaria is the problem, HIV, TB. Now we have to shift to tell people that, now look at the food, what you eat, exercising. Let me use another example of this sign or someone who is healthy, being healthy in some of our communities and our colleagues from our continent. Being healthy is having a good visible body.
Good visible volume.
Volume,
I like the
yes.
way you put that.
So now you have to tell, actually, no, this is risky, this is dangerous. and that shift is rooted into this new strategy, which I call it challenge and difficulty, because we are telling people things that never had before, and that is on the prevention side. On the diagnostic and management side, we also have a lot to do, especially making sure you have point of care management and systems, because the usual ways of diagnostics has been centralized. So now we see the importance of point of care systems. For example, we are equipping our community health workers with the BP machines. So in 3 weeks' time, you can screen the whole country using 58,000 community health workers. These are very easy and cheap means of diagnostic and screening that in our strategy we see that this will help to prevent diseases and manage. The other part, which is long, I would say complicated management, is on the consequences for NCDs that are not managed, like renal failure, like cardiac surgery, like renal transplant. These are really the stages that are also needed. We're establishing centers for renal transplant. In Rwanda, we started last year. Now we are doing renal transplant at least 2 to 3 every month. It was the first time because it was needed. So used to dialysis that people would take for so long. But now the real treatment would be renal transplant. These are things that are happening, but we wish to prevent more than doing more renal transplant or more cardiac surgery. And of course, the last one, the most important one, I would say, which kills actually more people, is cancer. With cancer, we have a very detailed strategy on cancer management, from diagnosis up to all the steps of management. So briefly, this is how our strategy is structured. And we have a lot of partners. Most of them are in the room. I've seen so many friends here. And I look forward to also hear from everyone on this conversation. Thank you.
Thank you. Thank you very much, and thank you for joining us. Katie, let me come to you. The last high-level meeting was 2018. Where have you seen the most progress since then, and where do the challenges remain?
Thanks, Julie. And let me also join others in saying thank you all for joining us today. I think this is, as Lois said, a real reunion and also a real rock star panel of NCD and global health advocates. So thank you all for joining as well. I think, when we, taking a step back in terms of the last high-level meeting, 6 years ago now, 7 years ago next year, I think the kind of the narrative or the story is almost a little bit like the great Western film, The Good, the Bad and the Ugly. I think there's absolutely things that we can be celebrating, but there are things that really are not going fast enough. I think in terms of the good, in terms of the 7 years since, it's really changed in terms of the global NCD agenda. We've got mental health and neurological conditions very much part of it. We're talking about a 5x5 approach, including air pollution. We've also got a number of different global strategies, action plans that have been developed around specific diseases and specific risk factors, which are really providing governments with concrete guidance on what to do to both prevent, early detect and treat each of these conditions. The evidence has really evolved in terms of what works. The best buys that we all cherish very dearly in the NCD community has increased from 16 to 28 interventions, which really show that the evidence has evolved, and there's technical packages that are really supporting governments in implementing them. Also, I think, and Bruce kind of touched upon this, I think there has been a real shift over the last 7 years in terms of the way that NCDs are viewed, rather than being seen as purely as an expenditure, to actually shifting to being seen as an investment. And I think the way that we've seen that happen is that many governments themselves have been developing national investment cases on NCDs, which really make the case for why investing in NCDs makes sense in the short term within political cycles, as well as in the longer term as well. And I think over the last 7 years, we've seen a great progress in the role of communities, in people living with NCDs being recognised. And above all, we've seen, as Bruce said, real country-level leadership, and as we heard from the Minister of Health of Rwanda, lots of examples of where we're really seeing traction and governments moving the needle in NCDs at the country level. But I think in terms of the bad is very clearly that we are off track. If you look at the hard, cold statistics in terms of progress against our 2025 targets that are all due to expire next year or in 2030, we are off track globally. Only 6 countries are on track to achieve the premature mortality target by 2025. And if we look at progress against certain risk factors, halting the rise in diabetes and obesity was the aspiration in 2012. It's going the wrong way, essentially. Yeah. The ugly, I would say, is the broader geopolitical environment that we're living in. We're living in an era of polycrisis. We've got climate change raging. We've got humanitarian crises raging with 300 million people around the world living in humanitarian crises. And we've got an economic recession in most countries with the cost of living crisis. So my point here is that it's very difficult from a health perspective to be getting our messages across. It's even more hard for NCDs, perhaps, against these many, many different challenges. And we're going to really have to cut through and make the case for why NCDs is relevant and integrated and connected to the bigger picture. I think the other kind of ugly side of it that we're facing from now until next year with the high-level meeting is just the reality of geopolitics. We've seen it with the pandemic agreement. It's difficult these days, particularly, to be getting multilateral agreements around bold international political declarations, for example. And that's something that we're going to have to really fight against, as well as the other fight that we're going to have, which we've always had in NCDs, is the very powerful industries, big tobacco, big alcohol, big food, who every step of the way are trying to interfere and undermine the policies and the solutions that we all know work. So I think those are some of the good, the bad and the ugly. I think it's very clear, as we'll hear throughout this panel, is that the high-level meeting next year really needs to represent a massive step change. It needs to have a significant focus on action and implementation on the ground, because that is where the biggest gap is. And we need to really also see it as an opportunity to almost reset the agenda, to future-proof the NCD agenda within this broader context of polycrisis?
Thank you, Katie. Ashley, one of the things that's been mentioned by almost every panelist is the impact COVID had on NCD mortalities. You led New Zealand's COVID response. Now, looking at population health, what is the progress on NCD strategies in your country? And is there something that could be scaled up, perhaps?
Thanks very much, and great to be part of the panel and the discussion today. My life's been dominated by communicable diseases for the last few years, so nice to be back on the NCD train here with the team. So a couple of quick comments. In Aotearoa, New Zealand, we've had tremendous success on the tobacco control area, and I want to draw 3 lessons from that. Our adult daily smoking rate now is under 7%, and more importantly, when I started in tobacco control in the early 2000s, over a third of our Indigenous Māori girls aged 14 were smoking every day. It's now 3%. And it's 3% for everyone in that group. So we've seen this tremendous closing of an equity gap. And that only happens, and here's the first point, it only happens if you have a comprehensive public health program. It's not because suddenly all our 14-year-olds woke up to the fact that smoking might kill them in 50 years' time. Actually, it was a really good program. The intergenerational impact of that is going to be profound. Lung cancer is still the biggest cancer killer of women in New Zealand, and that will start to change. Our cardiovascular disease rate, mortality rates are dropping year on year, and it's largely and immediately due to that drop in tobacco smoking. Another lesson from that is the need to persevere. This is a long haul game, and I've had examples of policies where the evidence hasn't changed in 10 or 15 years, but suddenly the political window of opportunity opens, and that's a lesson. Be ready as soon as that window opens to push it wide open and leap on through and actually take that opportunity, because political leadership in this area is absolutely essential. The area we haven't done well in, and I suspect it's the same in many of your countries, is trying to modify the food environment. Successive governments from the left and the right have just shied away from this, and I think we need to just rethink our approach here. We've got to do something different, because we know what needs to happen, but we've really struggled to get the political will to actually make the shifts that would make a profound impact. And just to your question about the link with COVID-19, well, it changed all of our lives, that's for sure. But one of the things we learned from New Zealand, a big lesson for us, was the power of effective communication to build trust in the population. We had a quite successful COVID response in Aotearoa, minimised deaths and prevented our health system from being overwhelmed and basically kept the virus out until we had high vaccination rates. But fundamental to that was building public trust. People understood the why, and perhaps we need to rethink, are we spending enough time to build trust in the population to understand the why, rather than just our tendency in public health is we can be a bit preachy. We know best. Actually, we found if we built trust, if we took people on the journey, and through the first 6 to 12 months of our response, we had over 90% of New Zealanders trusted the government's response. It was quite profound. So I guess my comment is the lesson from COVID-19 was, where you take the time to build trust, take people on the journey, tell them what you know, what you don't know, what the evidence is, when it changes, because people often get confused when the messages change. Then we're more likely to build the momentum we will need, and that all of you are really essential for, is building that kind of community momentum, and the role of civil society organisations, both domestically and internationally, is essential.
Ashley, thank you. Trevor, the depressing reality is that since the last high-level meeting, cardiovascular diseases still remain the world's biggest killer. In your assessment, what has changed on the ground?
Thank you, and let me extend a welcome to you all on behalf of the World Heart Federation. It really is wonderful to have this session as the last session in our World Health Summit, and work closely with the NCD Alliance in bringing it to you in such a wonderful panel. So thanks for everyone for your attendance. I have a good and a bad. I didn't think of the Western analogy, so I didn't get any uglies in there. But certainly I was a participant in the UN high-level meeting back in 2011, and it was an exciting time. It was the first, it was only the second on a health issue, and we really did get momentum quickly. And I think we should focus on the positives, the good. You know, we got from that a global action plan on NCDs. We had the 5x5 that followed. We've had subsequent global action plans on key issues like alcohol and physical activity, to name two. We've got terrific technical documentation, the HEARTS package. And from the perspective of my agency, and I'm sure yours, we've seen a escalation in the engagement with civil society and on the part of World Health Organization, welcoming us into the room to be part of the solution. So they're all the pluses, and that's not in any small way the result of the fact that we've had 3 UN high-level meetings on NCDs. If there's a failing, and there's a saying that I'll attribute to Richard Horton, the editor of The Lancet, is that what we have seen is a policy success and an implementation failure. Now that's probably a little bit out of date because we have wonderful initiatives occurring at member state level and in countries, but it is still true to say that there is a massive gap between what we know and what we do, and that gap is in implementation. So we can talk more about that later, but if I could leave you with one thought about what we need to be working concertedly on for the next 16 months, it is advocacy for implementation, to implement what we already know and about which we've seen disappointing progress.
Yeah, I think we'd all agree with that. I'm going to ask all of you what you want to see from the high-level meeting now. I'm very conscious of time, so I'm going to urge you, please, to keep your answers to just a couple of minutes if you can. Lois, I'm going to start with you. As we anticipate the political declaration on NCDs next year, what do you want to see from leaders?
I think it's exactly what Trevor said, right? We really, and Katie as well, first, it's really focusing on the implementation or execution of these goals that have been set with evidence and experience in mind, but it's also being honest about the opportunity or obligation to reset the agenda. I'd be remiss if I also didn't mention resources, especially coming from the U.S. government. You know, when I was in civil society, I could never talk about money. I never had any. Now, lo and behold, I have a president who, you know, has committed to a cancer moonshot initiative, which will have not just domestic but global implications, has established a new advanced research agency that is looking across NCDs, knowing that we are still so far away from critical innovations across the 5x5, right? So those are also elements that I hope are brought to the fore of the next high-level meeting, because those weren't investments or initiatives that were in place 15 or even 6 or 7 years ago.
Thank you, Lois. Dr. Zanzimana, from your national government perspective, what are you hoping to see in the high-level meeting next year?
Well, I think we have a lot to do on the lifestyle education. I believe, as I said before, it's important to design strategies and implementation, as you said, to what we tell our people and how we do it, and actually how we lead the talk, as we did this morning. So it's important to emphasize on the prevention, and the strategies should look at that in a very special way, like we did for diseases like HIV, malaria, and the others before. That is very important. Secondly, we also need to make sure that those who have been diagnosed with NCDs access medication in a way that it is not a burden to them and their families for a very long time. So access to medications with affordable prices is very important. And we need to work with pharma, with politics in manufacturing, so that the pricing or the unit cost for any medication for NCDs is affordable everywhere in the world, and the supply chain is uninterrupted. And that leads to the third element, which is financing, NCDs prevention and management, and partnership, of course, that we've experienced before. We had the example in New Zealand for COVID response. The trust is important, and who trusts who? I believe that there are 3 people or 3 categories need to bring together. This is the community that needs to trust the policymakers, and the policymakers who need to trust the scientists who are actually bringing the data and the evidence to be used.
Thank you. Ashley, what do you want? What are your aspirations?
Well, they say the secret to happiness is having low expectations. So perhaps avoiding Groundhog Day, in other words, an outcome document that looks just like the one in 2011. So what I'd love to see is a couple of new ideas that were actually looking to shift the dial, and a couple of things that were just really actionable, concrete things that political leaders signed up to. Would be really good. I mean, we don't want to be speaking just to ourselves. We want our political leaders to know you can make a difference. There is a legacy that you can leave here, and furthermore, this will help your country economically, socially, and culturally in terms of overall well-being. There's a great story to be told here. And finally, just back to tobacco control. Have we done everything we can with the FCTC? I think there's more we could do there, and maybe it's time to go back and have a look and say, right, should we be updating this? Because there's a lot more potential for us to prevent and manage NCDs through full implementation of the Framework Convention on Tobacco Control. Thanks.
Thank you, Ashley. Karen, a brief word from you about what you're hoping for from the high-level meeting?
Thank you. We being the Healthy Caribbean Coalition, very much would like to see in the high-level meeting that the Declaration of Bridgetown for the small island developing states are taken on board. The document, the outcome document for that is fairly general in the first part, but gives a very detailed plan of action. And there are some things in there that we want the high-level meeting to build on, and that is with respect to prevention, for example, dealing with the commercial determinants of health, and the issue of conflict of interest within this policy-making space has to be addressed when it comes to small island developing states. It's a challenge everywhere, but it's 10 times the challenge in the small island developing states. We also would like to see that the mechanism of coordination and of bringing all actors and all sectors around the table, involvement in the policy process from the very beginning to the implementation be improved. We talk about telling people what not to do. I think even among the sectors, the governmental sectors, they think that health owns all of the issues in relation to NCDs, and that we tell them, we orchestrate, and we tell them what to do. We have got to get the government to begin to bring everybody around the table, because the ideas, many of the ideas are not in the Ministry of Health. They're in other sectors and in the private sector as well. And thirdly, for financing, we've often said increase national resources. That's easier said than done. But what we are knowing that increasingly there are, I don't want to say pots of funds that are there that the Ministry of Health does not know how to leverage in order to make the linkages with NCDs and be able to access those funds. And so we need to call on the heads of government and heads of state to recognize those things like the Barbados Initiative or the Bridgetown Initiative and the initiative that came out of COP28 in terms of the funds for loss and damage. I was just trying to get the name right. Loss and damage. That Ministry of Health know about these things and understand what they do and what is the potential for them. And of course, climate change, where there definitely all of these sectors are going to be funds more than we have in the health sector as we go forward. And finally, I want to say that for us, enabling priorities, in fact, include, we have to have enhanced communication from policymakers. During COVID, our Prime Minister addressed the population almost every week at one point, and then, of course, it got less and less. But it drew the attention to the issue, and everyone listened. And we need to get heads to take on that role and that legacy in order to leave it for NCDs as well. So enhanced communication at all levels, including at the highest leadership level. And finally, capacity building for accountability. We call on civil society to hold the governments accountable. Many civil society organizations don't have a clue what we're talking about. So we need to build that capacity in the countries and to hold their hands in order to, in fact, give them that first report that they can discuss with the government as they go forward.
Thank you, Karen. Trevor, what are the priorities for the World Heart Federation?
Thank you. I alluded to this before, so there's two things. One is that we need to move the dial, to use that expression, towards vigorous approaches to implementation. So this means the things that we already know about driving the political leadership, the sustainable financing, the implementation of known, proven interventions, mobilizing technical support and capacity building where it's needed most in lower middle income countries, addressing the commercial determinants of health and the social determinants of health, the things that have been outlined before. The World Heart Federation, I thought there was a slide coming up on this, but it does, oh, there we go. It's on that screen, but not the other one. There it is there. I'm not going to go through this, but I'll use it just to explain that the World Heart Federation is developing a policy briefing on what needs to occur and what we would seek as the 4 key outcomes from the UN high-level meeting. And I want to acknowledge my co-chair of that committee, Jagat Narula, who's president-elect with the World Heart Federation. So there's 4 things. There's a lot of words here, but there are 4 things. It is a bold and forward-looking political declaration from the meeting in next year. The second, which is a drum I've been, it's actually the third that I've been beating, is ensuring implementation of those policy commitments. The other one, which is distinct to the World Heart Federation, is a call to action for national cardiovascular health plans in all member states. And the fourth is supporting evidence-based actions. This is where the implementing what we already know thing comes in. And these are grouped under cardiovascular health promotion actions, cardiovascular care actions, and cardiovascular patient and community actions. So this is a blueprint for what we need to do. It's underpinned by principles as well. It's in a consultation draft form at the moment. And we call on all of you and our 290 members in the World Heart Federation to join with us in using this as an advocacy tool in what is 16 months and counting.
Trevor, thank you. I'm going to ask a last comment from Katie. I'm very conscious we're coming to the end of the day and I don't want to delay anyone, but we might have time to take one question. So if there is someone, anyone questions, you'll have to come to the microphone. And Katie, I'm going to finish with you with the NCDA's priorities for the high-level meeting.
Thanks, Julie. So I think, we've obviously been around the block on high-level meetings in the NCD space, haven't we? This is going to be our 4th. We've learned a lot of lessons. And I think the first thing that we've learned in NCDA is that process is as important as the outcome. We've often called it the summit effect. We've basically got our issue in the spotlight for the next 16 months, and we need to make use of that and maximize it for every inch of our lives, basically, because it's going to be discussed at every single level, from national, local, regional, global. We need to use those discussions and those opportunities to build capacity and to strengthen consensus. I think in terms of our priorities of what we want to see come out of the high-level meeting, the other kind of lesson I wanted to mention is I do think it's so important that we as civil society are all singing from the same song sheet. If we're all shouting about different issues in different contexts, we're not going to get anywhere. And so I think making sure that we all have similar messages, similar priorities, and as WHF has done, making them specific to your specific disease or risk factor, that's the only way that we're really going to have an impact. And so just to say, in terms of our priorities, we're very much aligned with the World Heart Federation. Implementation is the first one. The second one is around mobilizing investment and resources. We've heard today the importance of domestic resource mobilization, but it's pretty much unethical and immoral if we're only focusing on domestic resources and not actually matching development aid to NCDs, because governments need support in low middle income countries, and that today is not happening. Number 3 is around breaking down silos. We've heard a lot on this panel today about the broader challenges and the importance of NCDs to those global health and development crises. I think, going to Ashley's point, what's got to be different at this next high-level meeting is that it's not just the NCD community that are there. It's got to be the HIV/AIDS community. It's got to be the environment and climate change community. It's got to be TB, really broadening the tent and focusing on those kind of win-win solutions that are good investments for multiple issues. Number 4, I think I'm on, is engaging communities. You know, as I said earlier, we've seen a huge amount of progress since the last high-level meeting on meaningful involvement of people living with NCDs, on the recognition of civil society within this space. Previous political declarations probably had one short paragraph on those kind of points. So this is an opportunity to really get political commitment around what's changed in the last 6 to 7 years. And then finally, as Karen said, it's all about accountability. You know, this high-level meeting is going to mark a new set of targets, a new global monitoring framework for NCDs. And out of this, I hate to say a meeting will have to come from a meeting, but we need to make sure that the next high-level meeting is not 7 years away, because it's too long. Thank you.
Yeah. Thank you, thank you. So look, we're really short of time. I'm going to only be able to take one question from the floor, so I don't know who was at the microphone first. I think it was the lady in the green, to be fair. I did see her hand come up. I'm so sorry.
Oh, thank you.
But in the interests of equity, I did see her hand go straight up. So a very quick question, if you would, please. Thank you.
Is this working? Okay. Hello, everyone. I'm Jackie Malouf from Beirut, Lebanon. I'm the founder and president of the National Diabetes Organization, Dialab, and the vice president currently of the International Diabetes Federation. So you can see I'm on both sides, civil society locally and on the global board of IDF. My comment is, after the unfortunate Beirut blast that I'm sure you all heard about, we were on the ground because we are the soldiers. We, us civil society, we were on the ground trying to see the needs and trying to help people. And I've had several conversations with international NGOs who were very much willing to help, having all the resources in the world where we were very short in resources, but they didn't know, they didn't have the data, they didn't have the language or the local way to communicate with people. So my comment to you, or question if you want, how to bridge this gap. They have the resources, they have the means, they have a lot of expertise indeed, but they need more expertise at a local level and to share those resources in order to empower local NGOs. You're talking implementation, implementation. We do the implementation, so we need empowerment. How will you make that happen?
Great question, great question. Thank you very much.
Well, I think you answered your own question, right? Just so you highlighted one of the priorities that we all need to work toward. I think we're short on time. Let's hit to the next. But the commitment, I mean, you see it here, right? It's how you work in partnership across government, civil society, the organizations like ours, the technical experts. The commitments are there, and part of this has got to be about tightening those up as we go forward.
Thank you very much indeed. And I want to say thank you to my panel for their insights into how we can advance the global health goals. I'm so sorry we don't have any time for any more questions because we're actually coming to the end of the entire summit. If everyone would stay in their seats for just a moment, I'd like to hand over to the director of the NCD department at the World Health Organization for some final remarks before we come to a close. Bente Mikkelsen, thank you. And there are no steps. Oh, very athletic.
So thank you very much. I'm not going to summarize anything. I just want to underscore it's time to lead for everyone. Don't look at heads of states only. I think we are still many months before the high-level meeting, and it's possible to accelerate as we are here today. And since it's the World Heart Federation, I think just the pure immoral fact that 1.3 billion people have hypertension, only 50% of them know that, and it really takes a very simple measure. Only 1 in 5 is on management. We have even protocol-based treatment. I think if we start with something like that and show results like Sir Ashley is saying, we build trust. That said, I think that the time to lead is at the global level. We have to continue at the regional level, and we have to support the Minister of Health of Rwanda on your call. And you have to call us. We have to stop to be so prescriptive. And I think this is what I see every time we go on mission. We still have a tendency to want to tell you what you should do while you should tell me.
I think we can be proud. Mentioning the SIDS and the Bridgetown Declaration, thank you very much, Karen. This is a nexus of environment, mental health, and NCD. We see for the first time, and sort of thank you to COVID, that we now realize that we need to include NCD into humanitarian setting. That was not the case 4 years ago. I think the main shift since the last high-level meeting is that we have dared to address that the financial structure is actually supporting the MDGs, not the SDGs, and we still only have 2% of the financial or the development aid coming to NCD. But we have also managed to shift to what we really need to do, mobilize domestic resources, and Bruce will help us because it's about essential benefit packages into the UHC. It's about to reduce the out-of-pocket payment and really provide equity through financial protection. So I just want to rapidly fire off. You have new Best Buys. They are updated. There is lots of things that everybody can do. We have established a Global Diabetes Compact, and thank you very much to the intervention from Beirut. We have new targets. We have the cervical cancer elimination initiative. We have the hearts. We have also now suddenly somebody that thinks that the third biggest killer of the world, chronic respiratory disease, is also worthwhile supporting. Thank you very, very much. But I think, as was said, there is good, bad, and ugly, and it's our opportunity, and it's your opportunity. We have an open call for inputs from the WHO. It's not us setting the agenda. It's the member states, it's the head of states, it's all of you. Please, all of you, come and tell us how can we really make the political declaration by supporting the heads of state the game changer that we are looking for. So thank you very much. I think this eminent panel shows us one thing. Nobody can do this alone. It is really all hands on deck. It is academia, it's civil society, it is the countries, the regions, all the global players, and we need to do it together. So I thank you. I promise to call on, and that's a huge pleasure, of course, to call on the CEO and the President of the World Heart Federation.